All right, so I just wanted to talk today and to get clarity for everyone in this community about our program at the Foundation Clinic and how our program is structured and why we've done it the way that we have. Because we sometimes receive a lot of criticism that we're not a 12-step program. And so in the treatment world, there are two, our program, which is the biopsychosocial model, versus the Minnesota model. The Minnesota model is underpinned by the 12-step fellowships. And what happens is when people go into a treatment facility, the treatment facility works with the clients through the steps. And it's been the form of treatment that's been around since the 60s, when the disease model was recognized, when alcoholism was recognized as a disease as a result of the success of AA. And so they took the 12 steps, the spiritual principles of the 12 steps, and medicalized it. And this is where the Minnesota model started. And the 12-step treatment models being exported around the world, and many people have found recovery as a result of the 12-step model. However, science and addiction treatment has progressed as we've moved away from the moral lens of people that take drugs there's something morally wrong with them, to the medical model where people who take drink and drugs, so there's something medically wrong with them. We've got our model, which is sitting in the wellness model. Yeah? And the way that we get people well is through the biopsychosocial model. So what that means is the biology of the person. So people come in and they get detox, so their body gets detoxed and they get medically cleaned out, for want of a better word. Then there's the psychology, that people get taught stuff while they're in the clinic. And then there's a social stuff where we create a social environment for our clients, which we call the therapeutic environment. And what separates us out from the rest of the world, I would say, because I haven't come across a program like ours, which is continuously changing and developing over time. So Marilyn, a clinical psychologist in 2005, came and spoke to us about trauma. So we incorporated trauma into the program, and we started to understand the importance of dealing with people's trauma. Yep. So we address that in the program. But our framework, our structure, is the foundation is spiritual principles. So if you if you look at the NA literature, there's a preamble that goes, our program is a set of principles written so simply we can follow them in our daily lives. And what we've done with that is, from the 12 steps, we've taken those spiritual principles and we put them in a framework around people's emotions. Yep. So the emotions are guilt and shame, anger, sadness, fear, and joy. And so the 3-week rolling program is the first week is spiritual principles, which comes from 12-step thinking and 12-step work. And we encourage our clients to go to 12-step meetings, but we have the 12-step meetings run the 12-step meetings by the fellowships. We don't think philosophically, we don't think it's right to be selling something that is freely given in a fellowship in our clinic. We just it feels ethically wrong to me personally, and to a lot of people, because of the way 12-step treatment facilities treat their clients at times. Yeah, it can be, and I'm not saying it is in every facility, but it can be quite shame-based or faith-based in a way that doesn't resonate with our philosophy. What we want is our clients to decide what works for them. So in our treatment facility, we have fellowship meetings that are run by the various fellowships, AA, NA, CA, and that should be governed by the fellowships, hospitals and institutions. So they should have a committee that works with institutions to introduce the 12-step program as a solution for people if they want it. What we do inside the clinic is we have the 12 steps stuck up on the walls, and the reason that we do that is the people that do identify with 12-step programs, they get that kind of similar feeling should they go to meetings anywhere in the world. So the residents themselves in the morning, they'll have a morning reading or something, which will be a reading from one of the fellowship's daily meditations or readings or something, and they're encouraged to go to meetings and to interact with people in recovery. However, there's a lot of shortcomings that happen within meetings where there can be a lack of boundaries, there can be sexual predation, there can be all sorts of challenges when interacting with mutual aid or peer support groups. So out there in the world, it's important that people understand what our program is. We are not opposed to the 12-step program. We believe that those spiritual principles are great, and we build on top of it with the brain and the mind, our thinking, metacognition, cognitive behavioral therapy. There's a lot of what people talk about. It's about thinking about your thinking about what's going on. So we integrate that into people, and what we want people to do is when they come to the clinic is to recognize what their trauma was in the past that they've been medicating to over the years, and to have a look at that with sober eyes in a contained environment, just so that they can then learn to stop using that trauma as a justification for their continued descent into addiction. Yeah, it's not our role to kind of process all that trauma and to go and dig there. We just want the person to kind of recognize it and for the story to come out so that they can look at it in a deeply compassionate environment. And then the third week of the program is community and growth. And this is what we've got here. We've got a community here. We've got a community of coaches. We have the support groups here. We have the systemic wellness practitioners running various groups. We've got the pocket rehab meetings. We've got a whole lot of recovery capital that can be added to other people's whatever works for them. So some people like to go to church, some people like to go to the mosque, some people like to go to various fellowship meetings, and we welcome that and we encourage that. But the boundary we have as a clinic is we are a clinic, and the word clinic comes from French. It means place of bedside learning, and we have a whole lot of professionals that are supporting our patients and their families why they are going through the recovery process. So we look at addiction as a systemic illness, which means one person's behavior can impact a whole lot of people. So the family gets impacted, society gets impacted. So when people come to the clinic, they're taken out of that environment and they do pretty well in the clinic, but they then go back to those environments that haven't changed. So part of our job is to work with those organizations and families to just kind of bring awareness and to kind of challenge the stigma that still sits around mental health. So I personally get very triggered when people criticize our program and say that we're not a 12-step program. Our clinic is shit because we don't follow the Minnesota model. And that's just not true. And the reason I get angry is, one, because it's not true. There's no evidence around supporting that. And that programs continuously need to adjust to the needs of the client and their families, as opposed to, so a recovery is an emergent thing, and mental illness is something that comes and goes. So I feel very passionate about this, because families, when they're in a crisis, and they don't know, and somebody talks to them about recovery, they're really open and susceptible, and they'll do anything that anyone tells them. In fact, one of our students, Toby Solheim, he did a research piece on it, and the summary of his research was that people will do whatever they're kind of told to do because they're desperate. So I really wanted to just kind of get this out to everyone today, and I hope you watch this and understand what our program is about, why we structure it the way it is, and what the recovery process is. Our goal in treatment is to make our clients aware of the recovery capital that's around them when they leave treatment. And while they're in treatment, we're trying to enhance the recovery capital internally for that individual to go and change their life. Because treatment, believe it or not, is very traumatic for the individual. There's a complete break of the persona, the identity. So when people start to the recovery process, they start to feel feelings that they haven't felt for years. The feelings can be very high and low. It's a very tight container that we need to contain fragile people in that are going through a traumatic process. Trauma's like too much, too soon, too quick. There's a real overwhelm, and when our clients start to get angry, we know the process, they're starting to get well. They're moving out of denial. And then we need to teach them how to manage their anger, how to get healthy boundaries around it. And if you want to relate that back to 12-step stuff, that would be steps 1, 2, and 3. And the spiritual principles around that are honesty, open-mindedness, and willingness. So do you think you've got a problem? Do you want to do something about it? And are you willing to do what it takes? And that's how we reference the 12-step lens to our patients while they're in treatment. So they have the program to follow, they have the lectures to follow, they have therapeutic duties, and that therapeutic environment, the guys start to relate and talk to each other around what recovery is for them. And our job as therapists or as coaches or as professionals is to maintain that culture of recovery within the clinic and within this online community here. So if you ever want to trigger me, criticize our program and what we've done, because we've been doing this for like 26 years now, just thinking and trying to work out how best we can support individuals and their families. Oh, hello, Rasada. Wish I could join. Look forward to hearing this. Oh, great. Well, I wish you could too, Rasada. See, Rasada does the trauma stuff with our clients. He runs groups where constellations and trauma stuff where he's helping the clients look at traumatic events and to build resilience for the individual. So when they go out into the outside world, they can start the process of healing their trauma in a way that suits them when they've got some more resilience. We just want the person to look at it and say, oh shit, okay, well, I was molested as a child, but I got to stop using that as an excuse to carry on my using, to justify my using. Yeah, so I'm going to end that now. Thank you very much. I'd love to debate this sort of stuff. I'd love to evidence it. And we as an organization are lived experience recovery organizations, and what we're trying to do here is take people's lived experience and to teach them how they can show up in a professional role, and whether that's a peer support specialist, whether that's a certified professional recovery coach, or whether that's a systemic wellness practitioner, that's what we're trying to do. And then we have the business coaching, which is about getting relationships right within organizations. So yeah, that's my rant or my education or whatever, and finally we have a multidisciplinary team. So each person brings their personal expertise to case management. So doctors, medical doctors, psychiatrists, social worker, coaches, psychologists, traumatologists, and the multidisciplinary team makes a decision around what's going to be beneficial for the client, and what the client is resisting, and what the family is, how the family's doing. And yeah, so that's our approach and our philosophy and our ethos. And as community members, this is the sort of thing that we need to maintain. Okay, thank you.